All right, let's dive deep into this um, world of the immune system. We
Yeah.
actually shared some information about your absolute neutrophil count,
Right.
or ANC.
Mm-hmm.
And we're going to unpack that number.
Okay.
We hear a lot about white blood cells,
Yes.
but today we're going like beyond the basics
Okay.
and zooming in on these little defenders
Yeah.
called neutrophils.
It is a smart move to be curious about your ANC because it's like a vital sign.
Oh, interesting.
It gives doctors a snapshot of your immune system's strength at any given moment.
Oh, okay.
So it helps to assess your risk of infection,
Okay.
especially if you're undergoing certain treatments
Okay.
or have, specific health conditions.
So it's not just whether your immune system's good or bad. It's like
Right.
this precise measurement.
Yeah, exactly.
So what exactly are neutrophils?
Okay.
What makes them so important?
Neutrophils are a type of white blood cell,
Okay.
and they're the most abundant type in your bloodstream. Think of them as the first responders of your immune system.
Okay.
When there's an injury
Yeah.
or an infection, neutrophils are the first ones on the scene ready to neutralize the threat.
Oh, so they're like the rapid response team.
Yeah,
Okay, that makes sense.
always on alert.
So how does this ANC actually get measured?
So it all starts with a simple blood test.
Oh, okay.
We look at your total white blood cell count,
Mm-hmm.
and then we zero in on what percentage of those cells are neutrophils, including the young ones,
Okay.
called bands.
So we're not just counting the total army,
Exact.
but we're seeing the proportion
Right.
made up of these frontline neutrophils.
Yes, exactly.
This is interesting to me. We can actually calculate ANC ourselves.
Exactly, and it's surprisingly straightforward.
Oh, really?
You take your total white blood cell count,
Hmm.
multiply that by the percentage of neutrophils and bands,
Okay.
and then divide by 100.
So let's say, hypothetically, my white blood cell count is 8,000. And the report says 70% of those are neutrophils and bands.
Huh.
So I would do 8,000 multiplied by 0.7 CU.
Yeah,
That comes out to 5,600.
that's right.
That would be my ANC.
You nailed it.
Wow.
Simple math.
Yeah.
But it gives us such powerful insight into your immune health.
So I'm guessing the interpretation isn't one size fits all.
That's right.
What makes an ANC normal,
Yeah.
and when should we be concerned?
So there are different ranges, each
Okay.
with its own significance.
Okay.
A normal ANC is typically considered anything above 1,500 neutrophils
Okay.
per microliter of blood.
Gotcha.
This suggests your immune system is well-equipped to handle most infections.
Okay, that's reassuring.
Yeah.
What happens if it dips below that 1,500 mark? What are
Yeah.
those other ranges telling us?
When the ANC falls below 1,500, we call it neutropenia,
Okay.
meaning a lower than normal neutrophil count.
Gotcha.
Mild neutropenia is between 1,000 and 1,500.
Mm.
Often this doesn't require any immediate intervention, but doctors might want to just monitor it over time.
So like a yellow flag.
Precisely.
Something to keep an eye on but not panic about.
Exactly. Gotcha. Okay. Then we have moderate neutropenia,
Okay.
which falls between 500 and 1,000.
Mm-hmm.
Here, the risk of infection,
Sure.
especially from bacteria and fungi,
Okay.
starts to increase.
Yeah.
So doctors might consider preventative measures,
Right.
like antibiotics
Yeah.
or closer monitoring.
Things are getting a little more serious now.
Right.
What about when it dips below that into severe neutropenia?
Yeah.
That sounds concerning.
It is. Severe neutropenia is defined as an ANC below 500.
Okay.
This significantly raises the risk of serious, potentially life-threatening infections,
Oh, wow.
and it often requires immediate medical attention
Okay.
to prevent complications.
Wow. That really underscores how vital these neutrophils are
They are.
to our well-being.
Yeah.
So knowing how crucial this ANC is, what could cause it to be abnormal in the first place?
Yeah.
What are the potential culprits we should be aware of? It seems like there could be a whole bunch of reasons why somebody's ANC might be off.
Yeah.
Where do we even begin to untangle all that?
You're right. It's a complex picture, but let's break it down.
Okay.
One of the most common causes of a fluctuating ANC is,
Yeah.
believe it or not, infection itself.
Oh, really?
When your body is fighting off an invader, whether it's a bacteria or a virus, it sends out those neutrophils to battle.
Uh-huh.
And this can temporarily lower your ANC, but it usually bounces back once the infection clears.
So it's like the troops are being deployed.
Exactly.
The numbers back at headquarters are temporarily dipped.
That's a great way to think about it.
Okay, so what about when the ANC is consistently low?
Yeah.
What else could be going on?
That's where things get a bit more intricate.
Okay.
We have to consider factors that impact the production
Yeah.
or lifespan of neutrophils.
Okay.
Certain medications, for instance, can have a significant effect on ANC. Chemotherapy is a prime example.
Chemotherapy, that makes sense.
Yeah,
Because it targets rapidly dividing cells.
exactly.
And that includes bone marrow,
That's right.
which is producing the neutrophils.
Exactly. It's a necessary trade-off in many cases, but it's definitely something that oncologists monitor very carefully.
Yeah.
They'll adjust treatment plans
Right.
or even prescribe medications to help boost neutrophil production if needed.
So ANC monitoring is crucial during chemo.
Yes,
So you don't get those infections
absolutely.
from
Yeah,
having a depleted defense force.
it's critical.
What about conditions that affect bone marrow itself?
Right.
How does ANC play into those situations?
Let's take aplastic anemia as an example.
Okay.
This is a condition where the bone marrow isn't producing enough blood cells
Mm-hmm.
across the board,
Yeah,
and that includes neutrophils.
gotcha.
So a low ANC along with other abnormal blood counts can be a sign that something is amiss in the bone marrow production line.
So it's like the factory itself is having trouble keeping up with demand.
Exactly.
So what kind of interventions might be considered in cases like this?
Well, treating aplastic anemia often involves identifying and addressing the underlying cause,
Okay.
which might range from infections
Right.
to autoimmune disorders to even certain medications.
Okay.
Supportive care like blood transfusions may be needed to
Yeah.
address low blood counts.
Yeah.
In some cases, a bone marrow transplant might be necessary to restore the marrow's ability to produce healthy blood cells.
So it's about getting to the root of the problem.
Right.
And
Yeah.
supporting the body in the meantime.
Absolutely.
We've talked about medications,
Yes.
bone marrow disorders.
Yeah.
What about autoimmune diseases?
Yeah.
How do they affect ANC?
Autoimmune diseases like lupus add another layer of complexity.
Okay.
In these cases, the body's immune system mistakenly attacks its own healthy cells.
Right.
And that can include neutrophils.
Okay.
This can lead to either decreased production or increased destruction of neutrophils,
Okay.
resulting in a lower ANC.
So in these cases, it's not just how many neutrophils are being made.
Right.
It's how long they're surviving in the body.
Exactly.
So what does ANC monitoring tell us about how somebody's autoimmune disease is progressing?
It's a valuable piece of the puzzle.
Okay.
A consistently low ANC in someone with lupus, for
Yeah.
example, might suggest that the disease is more active,
Okay.
needs more aggressive treatment.
Gotcha.
It's like a barometer,
Yeah.
giving us insights into the level of inflammation
Okay.
and immune system activity.
This is all starting to paint a much clearer picture for me.
Good.
We've talked about how ANC is used in situations like cancer treatment and managing certain diseases.
Right.
But I'm curious about what this means for those of us who aren't necessarily facing those specific health challenges.
Right.
Is there any value in understanding our own ANC, even if we're generally healthy?
That's a fantastic question.
Yeah.
While you might not need to track your ANC daily, like you might your weight
Uh-huh.
or blood pressure, having a basic understanding of it can definitely be empowering.
Okay.
It's like having another tool in your health awareness toolbox.
So if you're feeling run down or prone to infections, getting your ANC checked might be a good starting point to
Exactly.
figure out what's going on.
It's not about becoming fixated on the number itself,
Right.
but rather about understanding its significance
Mm-hmm.
and when it might warrant further investigation.
Okay.
It's about having an informed conversation with your doctor.
This is reminding me of something you mentioned earlier,
Yeah,
how ANC isn't always a straightforward measure.
that's right.
What are some of the nuances or misconceptions about ANC that we should be aware of?
One common misconception is that a low ANC automatically spells disaster.
Okay.
While it's true that a severely low ANC can be a sign of a serious condition,
Yeah.
ANC can fluctuate for a variety of reasons,
Okay.
including stress, exercise,
Oh, wow.
even the time of day.
So it's about looking at trends over time,
Exactly.
looking at someone's overall health, and not jumping to conclusions based on one reading.
Absolutely. It's like with any medical test.
Yeah,
It's one piece of data that needs to be interpreted in context.
that makes sense.
Another misconception is that ANC is a static measure.
Okay.
Like a cholesterol level, you get checked once a year.
Right. You're saying it can change from day to day.
That's right.
Yeah.
ANC is constantly responding to various internal and external factors.
Wow.
That's why regular monitoring is so important, especially for people with conditions that can affect neutrophil production.
Okay.
We need to see how those numbers are trending to
Okay.
get a more accurate picture of what's going on.
This has been incredibly helpful in clearing up some of those misconceptions.
Good.
Starting to appreciate the complexity of ANC and how it's not just about the number itself,
Yeah,
but the story that it tells within the context of a person's health.
I'm glad to hear that.
Speaking of uncovering information,
Yeah.
before we move on, I'm curious to hear about that case you mentioned earlier.
Yes.
It's the one that really stuck with you.
Uh-huh.
Would you be willing to share that with us?
Absolutely. This takes me back to my early days in the oncology ward.
Oh, wow.
We had a patient, let's call her Sarah,
Okay.
who was undergoing chemotherapy for breast cancer.
Go.
As we know, chemo can really suppress the immune system.
Yeah.
And Sarah's ANC started to drop after her first round,
Yeah.
as expected.
So her medical team was keeping a close eye on her ANC levels
Absolutely.
to manage that risk of infection.
Absolutely. We were taking all the standard precautions.
Okay.
Hand hygiene.
Yeah.
Infection control measures the works.
Right.
But despite our best efforts,
Yeah.
Sarah developed a fever.
Oh, no.
It definitely raised a red flag.
Especially with a compromised immune system.
Exactly.
What did you do next?
We immediately ordered blood cultures
Okay.
to identify the source of the infection
Mm-hmm.
and started her on broad-spectrum antibiotics just in case.
So you're being proactive, trying to get ahead of the infection before it takes hold.
Exactly. But here's where it gets interesting. Okay.
Her blood cultures came back negative.
Oh, wow.
We couldn't pinpoint the exact cause of the fever.
So a fever without a clear source.
Yeah.
That must have added another layer of complexity to the
but you will.
situation.
And to make matters more puzzling,
Yeah.
Sarah's ANC continued to fall.
Oh.
Even with the antibiotics,
Okay.
it dropped to dangerously low levels,
Mm-hmm.
well below the threshold for severe neutropenia.
So even though you couldn't identify a bacterial source for the infection, her body was clearly mounting a significant immune response.
That's exactly what was happening.
Okay.
And that's when it hit us.
Yeah.
We were so focused on the possibility of a bacterial infection that we hadn't considered other potential culprits.
Like a viral infection.
You got it.
Okay.
We decided to test for a panel of common viruses.
Mm-hmm.
And sure enough, Sarah tested positive for a particularly nasty strain of the flu.
Oh, so it's the flu all along.
It was.
Wow. What a reminder that even common viruses can have a significant impact.
On our immune system.
Especially when it's already weakened.
Especially when it's already weakened, that's right.
Exactly.
What happened to Sarah?
Yeah.
Did she recover?
I'm happy to report that she did.
Okay, right.
Once we identified the flu as the culprit,
Yeah.
we were able to provide targeted antiviral therapy and supportive care.
Okay.
Her ANC gradually recovered,
Oh, good.
and she was able to complete her chemotherapy regimen with minimal complications.
That's fantastic news.
It is a good outcome.
It's a testament to the importance of thorough investigation
Yes.
and a willingness to revisit assumptions
It is.
when things don't add up.
Absolutely. It also highlights the power of collaboration among
Right.
healthcare professionals.
Right.
It was the combined expertise of the oncologists,
Mm-hmm.
infectious disease specialists,
Yeah.
and lab technicians that ultimately led to the correct diagnosis and treatment plan for Sarah.
Teamwork at its finest.
It really is.
Before we wrap up this part of our deep dive, what are some key takeaways you hope our listeners will remember about ANC and its significance?
I think the most important takeaway is that ANC is a valuable window
Okay.
into the function of your immune system.
Right.
It helps us understand your risk of infection
Uh-huh.
and can be crucial in diagnosing and managing a range of conditions.
It's not just a random number.
No.
It's a vital sign that tells a story about what's happening inside our bodies.
Exactly.
And remember, it's important to consider ANC trends over time
Yes.
and to discuss any concerns with your doctor.
Absolutely.
Don't be afraid to ask questions and advocate for your own health.
That's excellent advice.
Well, we've covered a lot of ground in this part of our deep dive.
We have.
We've explored the causes of abnormal ANC, the importance of monitoring,
Right.
and even delved into a fascinating case study that highlighted the complexities of interpreting this vital sign.
It's been a pleasure sharing these insights.
Yeah.
And I'm looking forward to wrapping up our discussion in the final part of this deep dive.
Okay, so we've covered so much ground already,
We have.
from like the nitty-gritty of what ANC means to like these real-life scenarios where it becomes crucial. What I'm finding so fascinating is that ANC isn't just about reacting to problems.
Right.
It can actually guide us towards being proactive about our health.
Absolutely. It's not just about treating illness. It's about understanding our own resilience
Oh, I like that.
and taking steps to bolster our natural defenses.
That's a great way to put it. So what are some of those proactive steps people can take
Yeah.
once they understand their ANC? What comes to mind for you?
Well, first and foremost, knowledge is power.
Okay.
The more you understand about your own ANC and what influences it,
Yeah.
the better equipped you are to have informed conversations with your doctor.
Okay.
If you know you have a low ANC,
Yeah.
for example,
Yeah.
you can be extra vigilant about hand hygiene
Oh.
and avoiding contact with sick people.
So those everyday precautions become even more crucial. When you know your immune system needs that extra support,
Exactly.
what other proactive steps can people take?
Diet and lifestyle play a huge role.
Okay.
A nutrient-rich diet that supports immune function can make a big difference.
Yeah.
Think colorful fruits and vegetables,
Okay.
lean proteins and healthy fats.
Okay. The good stuff.
And don't underestimate the power of sleep.
Right.
When you're well rested, your immune system is better able to function optimally.
It's amazing how those foundational pieces,
Yeah.
diet, sleep, stress management,
Yeah.
they really do impact every aspect of our health,
You really do.
including our immune system.
Absolutely.
Sometimes those lifestyle changes alone aren't enough,
That's right.
especially if somebody has a medical condition affecting their ANC.
Yes.
That's where the medical interventions come in,
Right.
right? So we talked about some of those interventions earlier,
Yeah.
like GCSF for boosting neutrophil production.
Mm-hmm.
Are there other medical approaches that might be considered?
There are, depending on the underlying cause of abnormal ANC.
Okay.
Doctors might consider a range of options.
Okay.
For instance, if an autoimmune condition is attacking neutrophils,
Yeah.
medications to suppress the immune response might be necessary.
So it's about tailoring the approach to the individual,
Exactly.
not just throwing a blanket solution at the problem.
Right.
I'm curious, with all the advancements we're seeing in medicine,
Yeah.
what does the future hold for ANC monitoring?
Yeah.
Any exciting developments on the horizon?
Researchers are constantly striving to refine our understanding of neutrophils
Okay.
and develop more precise and personalized approaches
Okay.
to ANC monitoring.
So we're moving from a quantity-focused approach to one that looks at quality
That's right.
as well.
That's a great way to think about it.
What might that look like in practice?
Imagine being able to assess not just how many neutrophils someone has,
Yeah.
but how effectively those neutrophils are carrying out their tasks,
Okay.
fighting off infections, clearing out debris,
Yeah.
and orchestrating the immune response.
Wow.
These new biomarkers could help us predict an individual's risk of infection with much greater accuracy.
That would totally revolutionize the way we approach preventative measures
It really could.
and treatment strategies.
Right.
It sounds like the future of ANC monitoring is about moving towards a more personalized and predictive model.
It is, and that's incredibly exciting
Yeah?
because it holds the potential to significantly improve patient care
Yeah.
and outcomes.
Well, this deep dive has been incredibly enlightening.
It has.
We demystified what ANC means,
I did.
explored its implications in various health scenarios, and even glimpsed into the future of this field.
It's been fun.
As we wrap up, what are the most important things you hope listeners will take away from this conversation?
I'd say the most important takeaway is that ANC is more than just a number
Right.
on a lab report.
Mm-hmm.
It's a valuable indicator of your immune system's strength and can provide crucial insights into your overall health.
It's like having a window into your body's ability to defend itself.
Exactly.
And understanding that information can be truly empowering.
It can be.
And remember, ANC is just one piece of the puzzle.
It is.
It's important to consider it in the context of your overall health history, lifestyle, and any medications you're taking.
Absolutely.
So don't get fixated on a single number, but rather look at the trends over time
Exactly.
and have those open conversations with your doctor.
Couldn't have said it better myself.
Well, folks, we've reached the end of our deep dive into this fascinating world of neutrophils and the absolute neutrophil count.
Right.
Hope you've enjoyed this journey as much as we have.
Me too.
Knowledge is power, and understanding your ANC is one more tool you have to advocate for your own well-being. Think of your ANC as a vital sign, just like your temperature or blood pressure. It's providing valuable information about your overall health now that you know about ANC. What questions do you have for your own doctor about your immune health? Keep those questions in mind, and until next time, stay curious, stay informed, and stay healthy.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.